everybody, welcome back to CHIRO Coffee Chats. I'm Dr. Pete.
I'm Dr. Carla.
Today we're going to be talking about something really specific, which is problems with spinal discs. Before we get into that, I just want to mention my book here, Function Better, Feel Better, Live Better. In this book, 60 pages, big type, but it does cover a lot of problems, spine and joint related, and will give you a clear view and a better understanding of how those things may be affecting your life. But as I mentioned, today we're going to specifically be talking about discs. So disc protrusions, disc herniations, what are they? We got our spinal model here. You can see the vertebrae are here, and these big jelly-like things in between are the discs. If you've heard the term slipped disc,
that's a big one.
Yeah, it's not really accurate. It doesn't really happen. These discs, the fibers of the discs are like woven into the bones of the spine. So these things are providing actually a lot of stability to the spine. But what can happen is we human beings, we live in an environment where there's gravity, there's compressive forces on the spine, which can start to put pressure on the disc and start to tear the fibers that are on the outer part of the disc, and the nucleus pulposus, the jelly type material inside, can start to push out of the disc and then start to affect the nerves in the back here. And that's where we can get symptoms like what? The dreaded sciatica, pain down the leg. A lot of times when people will have a disc herniation, they will complain of a very irritating, burning pain down the leg. It could even be, sometimes they might think they have like a calf or a leg problem because they don't have any back pain. They just have really bad leg pain. And that can of course be coming from discs. So this is a very common problem.
Extremely common.
Right? And if we really look at, for disc herniations, it's more of a problem for younger individuals, people in their 30s and 40s, maybe 50s. When we get up into the 60s and 70s, we're usually dealing with more degenerative changes to the spine and to the discs. But disc herniations, if they're, it can be really painful. And the worst part about that is really interfere with people's lives. If you can't sit, you can't walk, you can't go to the gym because you got terrible leg pain or back pain, then that's no fun. So we're going to go over to our tables now. Come on over.
Come on over.
And we're going to show you some tests that we do in the office here to differentiate if someone has a disc problem. So when we look at the spine, we know from chiropractic school, we talk about this thing called flexion. That is the spine bending forward. So for a lot of disc problems, when the lower back in particular bends forward, that's going to push some of the discal material towards the back and hit on those nerves here that are running down into the glutes, into the lower legs. So one test that we can do, and again, if you're at home, obviously seek help from a professional, but if you're having sciatica or back pain, if this type of maneuver, this is called slump test. So Dr. Carla, if you swing your right leg over on top of the table, so if you do this on like a bed or a couch, so if you straighten your leg and then you slouch forward, if you have disc pressing on nerve, this will be either impossible because it's too painful, or you will get worsening of pain going down into the leg. So that's called slump test. And basically what that's doing is it's stretching out the nerves in that area. And if they are getting caught up in a disc, that's gonna put more pressure on and it's really gonna create a lot of pain going down the leg. Another test that we do, let's get you lying on your back, is called the straight leg raise. So let's say Dr. Carla has some left-sided lower back pain and it's shooting down the back of her thigh, perhaps into her calf. This is a test we can do to sort of see if it's related to nerve issues in the back. And basically, as the test is called, we're just keeping the leg straight and we're raising it. In a normal person, you might get up to about here, so not quite 90 degrees, but we're encountering, you probably feel a bit of hamstring tightness there, right? In a person with a disc herniation that's pressing on the nerve, you may get them to around 20, 30 degrees, and then they're gonna like seize up and they're gonna say ouch, and they're gonna get a jolt of pain going down the leg. So this is a really, also a good test. And what we're really trying to differentiate with these tests is it a disc problem or is it a joint problem? So the joints in the back of the lumbar spine and the SI joints, they will tend to be flared up from some different movements. And these types of things, so flexion of the spine or straightening the leg, will not cause a worsening of their symptoms. So some more tests we do in the office to see if someone is having a disc herniation that's affecting their nerve supply to their leg in a significant way is to check reflexes and strength and sensation. So I can ask Dr. Carla, can you kick out against my hand? Great, she's got good strength, pull in. And even if I'll ask her to hold her ankle and not let me move it, and I try to move it and she's got good strength there, which is great. We can also check reflexes. So the patellar reflex is one in the leg that Dr. Carla has a nice brisk reflex there. You can also check the Achilles, and she's got a nice reflex there. In someone who's got a lot of nerve compression, we may have an absent, no reflex, and the strength test may be weak, and there may be altered sensation. So if we don't have it here, but if we had a pin, we would have Dr. Carla close her eyes and we would touch with a sharp pin and then alternate with a dull object and see if she can differentiate the difference. If that nerve is really in trouble, she may just feel a vague sensation and not be able to tell the difference between sharp and dull. That would indicate a nerve problem, possibly from disc.
All right, so if you do feel like you have a disc herniation, you can go get checked out by your local chiropractor or come see us and get evaluated. A lot of chiropractors will take images of your spine to determine where the disc herniation might be. There's x-ray analysis and there's also an MRI of your spine. An x-ray is a picture of the bones itself, and remember the discs are in between each of the vertebrae, so they won't necessarily show up on an x-ray, but you will see misalignment of the spine in various areas, especially in that low back, as the biomechanics change, as you walk differently, as you move differently because of the disc herniation and the pain. So we can definitely get a lot of information from an x-ray. An MRI will actually look at the soft tissues of the spine, so the discs in between each of the bones, and tell you exactly where that disc has protruded or is impinging on the nerves coming out at each of the levels there.
Here's a question for you. So let's say I'm a patient, I've had back pain, sciatica, I've gone to my medical doctor, I went for an MRI, and they said you have disc herniations at L4-5 and L5-S1. How would that knowledge change potentially any treatment that I would get for this kind of problem? Does that automatically rule out certain things? Or this is assuming I'm not in I don't have terrible symptoms, equina.
Okay, it doesn't necessarily change anything if you're very acute and in a lot of pain and unable to get in certain positions. Again, there's different ways of adjusting the low back area and how we would go about treating it. But again, it's just like any other adjustment. We're trying to get the spine moving in those areas that are locked up and free up those areas so that the discs in between can heal and pull back that disc material back into the center of the disc and away from the nerves.
And so basically what you're saying is these types of things, it's conservative care that we do. It's generally not, you don't jump from MRI to surgery, for instance.
Right.
And if we really look at, what is it that causes disc problems in the first place, it's abnormal, as Dr. Carla mentioned, biomechanics or abnormal movement of the spine. So there's research that indicates that if there's, for instance, two segments of the spine that do not move or that move too much, those can be things that create abnormal forces that cause discs to wear out. So our sort of solution preventative-wise is to keep all of the segments of the spine moving properly. Now, in yourself, you don't really know if you're doing that.
Right.
And that's another place where a professional can evaluate you and see how each of the segments of your spine are moving. Ones that aren't moving appropriately, we can get them doing better and sort of stop the abnormal pressures going through the disc. But if you've got a full-blown herniation, again, we're looking at conservative care, and time is required too. And we know also from research that slowly over time, disc problems can improve, like on MRI. It's not something that happens quickly, but it can happen slowly. So if you do have disc herniations, you've been told you do, you've had MRIs, that doesn't mean you're stuck with necessarily back pain and sciatica for the rest of your life. There's conservative care options for you, and your body will be trying to heal that as well, which is good news.
Just takes a little bit of time. The disc is comprised of two different areas, the inner and outer, and the outer has a very minimal blood supply as well, so healing is a lot slower. So time is your best friend with disc herniations, and keeping the total spine health is the biggest key.
So there's some information for you on disc herniations. Thanks for watching. Be sure to like and
comment and subscribe.
And on our next video, we're going to talk about some different treatment things we do in the office to deal with patients who are suffering with disc problem and sciatica. So we'll see you on that video.